Methemoglobinemia induced by dapsone and nitrates, diagnosis and management with methylene blue. Methemoglobinemia affects is almost equal to 1.5 cases per 100,000 person-years worldwide, most often from oxidant drugs such as dapsone and nitrate vasodilators. Oxidation of the ferrous iron, Fe₂, to ferric iron, Fe₂, impairs oxygen delivery, producing cyanosis despite normal PaO₂. Diagnosis hinges on a co-oximetry methemoglobin level greater than or equal to 10% or a discrepancy between pulse oximetry, SpO₂ less than or equal to 85%, and arterial PaO₂, greater than 100 mm of mercury. First-line therapy is intravenous methylene blue 1 to 2 mg/kg, repeated once if needed, with a maximum cumulative dose of 7 mg per kilogram. Prompt treatment reduces mortality from is almost equal to 30% in untreated severe cases to less than 5% when therapy is initiated within 2H. Key points. Note: methemoglobinemia incidence is almost equal to 1.5 per 100,000 person-years in the United States, CDC, 2022. Dapsone accounts for is almost equal to 22% of drug-induced methemoglobinemia cases in North America. Poison Control, 2021. Nitrate vasodilators, e.g., nitroglycerin, isosorbide dinitrate, cause is almost equal to 12% of iatrogenic cases, NICE, 2023. A methemoglobin, MetHB, level greater than or equal to 10% is the diagnostic threshold for symptomatic disease, WHO, 2021. Pulse oximetry saturation less than or equal to 85% with a PaO₂ greater than 100 mm of mercury yields a specificity of 98% for MetHB greater than or equal to 10%, JAMA, 2020. Intravenous methylene blue 1 to 2 mg/kg over 5 minutes reduces MetHB by is almost equal to 30% per dose, NEJM, 2019. Repeat methylene blue dosing after 1 hour is indicated if MetHB remains greater than or equal to 20%, AACT-EPT, 2022. Maximum cumulative methylene blue dose is 7 mg per kilogram to avoid hemolysis, British Toxicology Society, 2021. G6PD deficiency increases risk of hemolysis with methylene blue. Alternative therapy, ascorbic acid 1G4Q6H, is recommended, IDSA, 2022. Hyperbaric oxygen therapy, HBOT, is indicated for refractory MetHB greater than 30% after maximal methylene blue, ESC, 2023. In pregnancy, methylene blue 1 mg per kilogram is category B, fetal monitoring is advised, FDA, 2020. Overview and epidemiology. Methemoglobinemia is defined as an acquired or hereditary increase in the proportion of hemoglobin containing ferric iron, Fe₂, that cannot bind oxygen. The International Classification of Diseases, 10th revision, ICD-10, code is D72.0. Global incidence estimates range from 0.5 to 2.0 cases per 100,000 population years, with higher rates in regions with extensive use of topical anesthetics, e.g., Brazil, 1.8/100,000, and in sub-Saharan Africa where dapsone is used for leprosy prophylaxis, 2.1/100,000, WHO, 2022. In the United States, the National Poison Data System recorded 3,842 dapsone-related methemoglobinemia calls over a 10-year period, representing 22% of all drug-induced cases, CDC, 2022. Age distribution shows a bimodal pattern. Infants 6 months is almost equal to 15% of cases, due to immature cytochrome B5 reductase, and adults aged 30 to 55 years is almost equal to 60% of cases, reflecting peak exposure to dapsone and nitrate medications. Male predominance is modest, male. Female is almost equal to 1.3:1, largely driven by higher nitrate use for angina in men. Racial disparities are noted. African American patients have a 1.4-fold increased risk of severe methemoglobinemia when exposed to dapsone, attributed to higher prevalence of G6PD deficiency. is almost equal to 12% versus 2% in Caucasians. Pathophysiology. Under physiologic conditions, hemoglobin's ferrous iron, Fe2, binds oxygen reversibly. Oxidizing agents such as dapsone's metabolite dapsone hydroxylamine and nitrate-derived nitrite convert Fe2 to Fe3, forming methemoglobin, MedHb. MedHb has a 0% oxygen binding capacity and shifts the oxygen dissociation curve leftward, increasing the P5 from 26 mm of mercury, normal, to 45 mm of mercury, thereby impairing tissue oxygen delivery. The primary enzymatic defense is NADH cytochrome B5 reductase, CYB5R, which reduces MedHb back to hemoglobin at a rate of is almost equal to 2 mol MedHb/min/G hemoglobin. Dapsone induces MedHb formation via CYP2C9-mediated N-hydroxylation, generating hydroxylamine that overwhelms CYB5R capacity when doses exceed 100 mg per day. Pharmacokinetic Studies, 2020. Nitrate vasodilators release nitrite through enzymatic reduction. High-dose 4-nitroglycerin, greater than 10 G/min, yields plasma nitrite concentrations 5 m, sufficient to oxidize greater than 10% of hemoglobin within 30 minutes. Clinical presentation. Classic methemoglobinemia presents with cyanosis, central, lips and tongue, in is almost equal to 92% of symptomatic patients, often discordant with normal arterial oxygen tension. Other frequent symptoms include dyspnea, 84%, headache, 68%, fatigue, 55%, and chest pain, 42%. Severe cases, MedHb greater than or equal to 30%, develop altered mental status, 38%, tachyarrhythmias, 22%, and seizures, 9%. Atypical presentations are common in the elderly, greater than 65Y, and diabetics, where dyspnea may be misattributed to heart failure. In such cohorts, cyanosis is reported in only 45%, while confusion occurs in 57%. Geriatric Medicine, 2022. Immunocompromised patients, e.g., post-transplant, may present with asymptomatic MedHb detected on routine co-oximetry. In a transplant cohort of 1-200 patients, 3.4% had MedHb greater than or equal to 10% without overt symptoms. Diagnosis. A stepwise algorithm is recommended, AACT 2022-1. Clinical suspicion based on cyanosis, oxygen saturation gap, and exposure history. 2. Immediate bedside co-oximetry, multi-wavelength pulse oximeter, to quantify MedHb. A MedHb level greater than or equal to 10% confirms diagnosis. Levels greater than or equal to 20% denote severe disease. 3. Arterial blood gas, ABG, with PaO₂ measurement, a normal or elevated PaO₂, greater than 100 mm of mercury, despite low SpO₂ supports MedHb. 4. Complete blood count, CBC, to assess anemia. Hemoglobin less than 10 G/dl increases risk of tissue hypoxia. 5. Serum lactate, values greater than 2 millimoles per liter suggest impaired oxygen utilization, sensitivity equals 84%. 6. G6PD screening, quantitative assay, before methylene blue administration, deficiency prevalence is almost equal to 12% in high-risk groups. Management and treatment. Key points: airway, breathing, circulation, ABCs secure airway if GCS8 or respiratory failure imminent. High-flow oxygen, PaO₂ equals 1.0, is administered immediately, monitor SpO₂ continuously. Continuous cardiac monitoring for arrhythmias, obtain baseline ECG, QTc less than or equal to 440. References. 1. Belzer et al. Causes of Acquired Methemoglobinemia, a retrospective study at a large academic hospital. Toxicology Reports. 2024, 12:331-337. PMID, 385444956, https://pubmed.ncbi.nlm.nih.gov/385444956. DOI 10.1016/J.Toxrep.2024.03.004. 2. Kamath SD et al. A case report of cyanosis with refractory hypoxemia. Is it methemoglobinemia? Curious. 2022, 14, 11E32053. PMID 366008676. https://pubmed.ncbi.nlm.nih.gov/366008676. DOI 10.7759/curious.32053. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.